The world watches China once again as a new virus dominates headlines. Human Metapneumovirus, or HMPV, is surging through the country. Hospitals are seeing an influx of patients, particularly young children. While this raises understandable concerns, it's important to approach this situation with clear information, not fear. HMPV is not a novel virus like COVID-19. It's been circulating for decades, often causing mild cold-like symptoms. However, recent trends demand attention. Understanding HMPV, its risks, and how it spreads is crucial for global health. This essay will delve into the facts about HMPV, its comparison to other viruses, and the steps individuals can take to protect themselves and their families. Knowledge is our strongest defense against unnecessary panic. Human Metapneumovirus, commonly shortened to HMPV, is a respiratory virus with a global reach. It affects people of all ages, but is particularly concerning for certain vulnerable groups. First identified in 2001, HMPV has likely been causing illness for much longer. Historical medical records suggest that the virus has been circulating undetected for decades, if not centuries. It belongs to the same family as the viruses responsible for the common cold and respiratory syncytial virus, or RSV. This family of viruses is known for causing respiratory infections that can range from mild to severe. HMPV is highly contagious, spreading through respiratory droplets expelled when an infected person coughs or sneezes. These droplets can travel through the air and be inhaled by others, leading to new infections. It can also be transmitted through direct contact with contaminated surfaces. Touching a surface that has the virus on it and then touching your face can lead to infection. Most people contract HMPV at some point in their lives, often during childhood. Children are particularly susceptible as their immune systems are still developing. While many experience mild symptoms and recover fully, HMPV can pose serious risks to vulnerable populations. Symptoms can include cough, fever, nasal congestion, and in severe cases, difficulty breathing. Infants, young children, the elderly, and those with compromised immune systems are particularly susceptible to severe complications. These groups may require medical attention and, in some cases, hospitalization to manage the illness. China's healthcare system is grappling with a significant surge in HMPV cases. The number of infections, particularly among young children, has risen sharply in recent weeks. Hospitals are reporting overwhelming numbers of patients seeking treatment for respiratory illnesses. This surge is placing strain on medical resources and raising concerns about the potential for wider outbreaks. The situation highlights the importance of robust public health infrastructure and the need for ongoing surveillance of infectious diseases. While the situation in China is serious, it's crucial to maintain perspective. HMPV is not a new virus, and healthcare professionals have experience managing its effects. However, vigilance and proactive measures are essential to control the spread and minimize the impact on vulnerable populations. Section 4. HMPV versus COVID-19. Separating fact from fiction. The emergence of HMPV amidst the backdrop of the COVID-19 pandemic has led to understandable anxiety and concern. However, it's crucial to distinguish between these two viruses and their respective characteristics and impacts. While both are respiratory viruses, they differ significantly in their transmissibility, severity, and pandemic potential. HMPV is not as easily spread as COVID-19 and generally causes milder illness in most individuals. Unlike COVID-19, which emerged as a novel virus, HMPV has been circulating for decades. This means that a significant portion of the population has some level of pre-existing immunity, which can help to mitigate the severity of outbreaks. Section 5. Who is most vulnerable to HMPV? While HMPV can infect anyone, certain groups face a higher risk of developing severe complications. Understanding who is most at risk can help in taking preventive measures and ensuring timely medical intervention. Infants and young children, particularly those under the age of 2, are most vulnerable. Their immune systems are still developing, making them more susceptible to respiratory infections. This age group often requires close monitoring and prompt medical attention if symptoms appear. Their immune systems are still developing, making them more susceptible to respiratory infections. Parents and caregivers should be vigilant about symptoms and seek medical advice early. Older adults, especially those over the age of 65, are also at increased risk. As people age, their immune systems may weaken, making it harder to fight off infections. Regular health checkups and vaccinations are essential for this age group. Their immune systems may weaken with age, making it harder to fight off infections. This makes it crucial for older adults to maintain a healthy lifestyle and stay informed about potential health risks. Individuals with weakened immune systems, such as those with chronic illnesses or undergoing cancer treatment, are also more susceptible to severe HMPV infections. These individuals should follow their healthcare provider's advice closely and take all recommended precautions. It's crucial for these vulnerable groups to take extra precautions to prevent infection, such as practicing good hand hygiene, avoiding close contact with sick individuals, and staying up to date on vaccinations. By being proactive, they can significantly reduce their risk of severe illness. Section 6. Recognizing the symptoms and preventing spread. Understanding the symptoms of HMPV is crucial for early detection and prompt medical attention. The virus typically presents with cold-like symptoms, including runny nose, cough, congestion, fever, and sore throat. In infants and young children, symptoms may also include wheezing, difficulty breathing, and a decreased appetite. In severe cases, HMPV can lead to bronchiolitis, pneumonia, and respiratory failure. Preventing the spread of HMPV relies on simple yet effective measures. Frequent hand washing with soap and water is essential, especially after coughing or sneezing and before touching your face. Covering your mouth and nose with a tissue or your elbow when you cough or sneeze helps prevent the spread of respiratory droplets. Section 7. Navigating the global HMPV landscape. The surge in HMPV cases extends beyond China, with other countries, particularly in the Northern Hemisphere, reporting increased activity. This rise in cases is a significant concern for global health authorities, as it indicates the virus's ability to spread rapidly across borders. This global trend underscores the interconnectedness of infectious diseases and the importance of international collaboration in monitoring and responding to outbreaks. Scientists and healthcare professionals from around the world are working together to share data, research findings, and best practices to combat the spread of HMPV. While there is no specific antiviral treatment for HMPV, supportive care measures can help manage symptoms and prevent complications. These measures are crucial in providing relief to patients and ensuring that the healthcare system can cope with the influx of cases. These may include over-the-counter pain relievers, fever reducers, and decongestants. Such medications can alleviate discomfort and help patients recover more comfortably at home. In severe cases, hospitalization may be necessary to provide respiratory support and intravenous fluids. Intensive care units are equipped to handle these critical cases, ensuring that patients receive the necessary medical attention. Prevention remains the most effective strategy for combating HMPV. Simple actions like regular hand washing, wearing masks, and disinfecting surfaces can significantly reduce the risk of transmission. By understanding the virus, its transmission routes, and implementing preventive measures, we can collectively reduce its impact on global health. Public education and awareness campaigns play a vital role in informing communities about how to protect themselves and others.